When you take out, you say you take out about 70% of the stomach.
Yes, sir.
How long does it take what's the eating like after you get through, and how long does it take them to get better?
Well, right after surgery, of course, patients are on a purely liquid diet for 2 to 4 weeks. And then they go through a progression of pureed phase to soft foods to regular food over time.
Over time, let's say a year, how much weight have they lost?
You know, usually my patients will lose about 65% of what we call their excess weight. So if they're 100 pounds overweight, the average patient then would lose about 65 pounds.
What do you do about those other 35?
Well, at that point, they're usually down to a reasonably healthy weight. You know, a patient can be technically overweight and from a medical standpoint not have a lot of health risk. So our goal is to get them out of obesity, get their BMI, if you will, below 30. My goal is 28 or less for my patients.
Now, do you force people or recommend people or guide people toward losing weight before the surgery?
Oh, absolutely.
Why is that?
Because that is the one thing that we can do before surgery that reduces surgical complications.
So you have them go on a weight loss diet. Can most people lose weight during that period of time? You recommend it?
Most people do. My patients can lose weight in the short term. Their real difficulty is keeping the weight off long term.
I've had 2 or 3 patients that have had surgery under your guidance and have done so good. What does the patient say to you when they come back? Are they weak? Do they feel, because they've lost so much weight, do they feel tired, or they still have a lot of energy?
You know, initially after surgery, fatigue is a big factor because frankly, they're not getting very many calories. But after they've lost the weight, 6 months, 3 months later, in that range, boy, they are energized and excited about what's happening.
Now, the people that I've seen really haven't, that you've done the surgery on, they just say, I feel good and I've got a lot of energy. Do you have to replace certain vitamins and nutrients?
Yes, we have formal recommendations from our societies recommending the appropriate vitamin and mineral supplementation after surgery. So we follow their guidelines.